Were you watching your show?
Yeah.
Did you screw the TV up again today?
I don't think so.
Okay, good.
Deborah Brannan, a retired nurse, has been providing her husband Tom with 24/7 medical care at their home in Surrey for the last decade. Tom was diagnosed with Alzheimer's and multiple sclerosis, and Deborah says she's running out of time and options.
I just was so exhausted after everything. The idea of going and being formally diagnosed with breast cancer was just so gone. But for my birthday present to myself, I gave myself a mammogram.
The breast cancer diagnosis coming this past week, and Deborah is facing a harsh reality of putting her own health aside and not being able to take care of her husband of 17 years. With Tom's health and safety becoming more of a risk at home, Deborah has looked for long-term care options, which has proved to be a troublesome search.
And I didn't get any assistance. And when I said, could he be assessed for long-term care? They were accusatory almost of, like it's my fault because I've chosen to look after him for 2 years at home.
Deborah says Fraser Health have done multiple long-term care assessments and have offered 1 hour a day morning visits, which she says isn't good enough.
They said they only shower them once a week and they'll shave him once a week. And I'm like, okay, so you're gonna come and give him, wash him, put him in his clothes, put him in the chair. That's really not helping his safety issue. He needs to be in a wheelchair, but as you can see, there's no room for a wheelchair here. He's basically a prisoner in this apartment, in that room, because it's the only room that's safe for him.
After a scary moment when Tom fell down the stairs outside their basement apartment, Deborah took to social media looking for answers and was overwhelmed by the community support and shocked by how many people have similar experiences.
People are genuinely concerned that I'm going through this, but also I'm devastated that I'm hearing stories of all these other people who've had to abandon their loved ones at the hospital and refuse to take, and even then, their loved ones are being sent home in a taxi. If we, as a caregiver, say we can't look after them, why is nobody believing us?
In a statement to City News, Fraser Health says our home health team met with the person and his family yesterday to access the services and supports he needs, including home support and an assessment for long-term care. We are in close contact with the family regarding next steps while the assessment is underway. The community health nurse will collaborate with them to develop a care plan to help them continue to live at home.
For the last 10 years, I've looked after him. The last 2 years in his failing health, I've looked after him. I never would abandon him.
While Deborah says she's not feeling optimistic about results, her, Tom, and their dog Jazz hope that some sort of change can come from their own experience. In Surrey, Joe Sadowski, City News.